Ladies and gentlemen, this is a story that came out on NPR December 13th, 2018. Nurse denied life insurance because she carries naloxone. But wait a minute, over in Pennsylvania, they're giving it to people for free. I wonder what's going to happen to their life insurance policies now that the state is handing out free Narcan. So does that cancel out everybody's policy in Pennsylvania that's carrying it? The state is giving it to them for free. Oh boy. Woo, this system sucks. It sucks. It sucks. All right, let's get into this. Blood work was supposed to be the last step in Acela application for life insurance, but when she arrived at the lab, her appointment had been canceled. That was my first warning. Acela says she contacted her insurance agent and was told her application was denied because something on her medication list indicated that Acela uses drugs. Acela, a registered nurse who works in an addiction treatment program at Boston Medical Center, scanned her medical list. It showed a prescription for the opioid reversal drug naloxone, brand name Narcan. But I'm a nurse. I use it to help people. Acela remembers telling her agent, if there is an overdose, I could save their life. That's a message public health leaders aim to spread far and wide. Be prepared. Get naloxone. Save a life. Yeah, they're actually putting up billboards about having Narcan on you. Was the message at the top of a summary advisory from the U.S. Surgeon General in April. So again, how could you penalize her when the Surgeon General, the U.S. Surgeon General, is telling everybody to get Narcan so that you can help these drug addicts out here? So if the U.S. Attorney General is telling the public this, which I've done a video on, then how can you slap her down for life insurance? I guess it wasn't meant for us to save a life, y'all, because if you got a life insurance policy and you got Narcan on you, they can deny you. You had Narcan. So what if people that have life insurance get killed in an accident and you find Narcan on that person? Does that mean you don't pay out to the family? Because if that's the case, a lot of people are going to take that Narcan and throw it in the trash. But some life insurers consider the use of prescription drugs when reviewing policy applicants, and it can be difficult, some say, to tell the difference between someone who carries naloxone to save others and someone who carries naloxone because they are at risk for an overdose. Well, ladies and gentlemen, since they can't figure this shit out, don't carry Narcan at all. That's how I see it. Primerica is an insurer. Acela says turned her down. NPR agreed to use just Acela's first name because she is worried about how this story might affect her ongoing ability to get life insurance. The company says it can't discuss individual cases. Amazing, right? But in a prepared statement, Primerica notes that naloxone has become increasingly available over the counter. Now, if a life insurance applicant has a prescription for naloxone, we request more information about its intended use as part of our underwriting process, says Kenneth Hancock, the vice president for corporate communication. Primerica is supportive of efforts to help turn the tide on the national opioid epidemic. No, you're not. Because if you're going to turn people down, you're not for helping people through the plague at all. After Primerica turned her down, Isela applied to a second life insurer and was again denied coverage. So as long as she has Narcan in her possession, y'all, she can't be insured for life insurance. Wow. But the second company told her it might reconsider if she obtained a letter from her doctor explaining why she needs naloxone. So Isela did contact her primary physician and then realized that her doctor had had not prescribed the drug. Isela had bought Narcan at a pharmacy. Okay, so she just bought it out of a pharmacy, which is available. It's available at the pharmacies all around me. So I'm sure it is all across the country. So she bought this out of the pharmacy, and now that she has it in her possession, she's being denied life insurance. So Acela did contact, okay, so she bought it. So let me just go down a bit. Um, to help reduce overdose deaths, Massachusetts and other states have established a standing order for naloxone, one prescription that works for everybody. Isela couldn't just give her insurer that statewide prescription. She had to find the doctor who signed it. As it happens, that physician, Dr. Alex Wally, also works at Boston Medical Center. Wally is an associate professor of medicine at Boston University. He also works in addiction medicine at Boston Medical Center and the director for the opioid overdose prevention pilot program at the Massachusetts Department of Public Health. We want naloxone to be available to a wide group of people, people who have had opioid use disorder themselves, but also those in their social networks and other people in a position to rescue them, Wally said. So they're saying right up front, yes, we want the drug addicts to have naloxone, but we also want people that are not on drugs to have this naloxone too. But as you can see, that poses a problem when it comes down to insurance. Now, if they are rejecting her policy because of naloxone, just imagine if somebody that is a nurse and they are driving to work and get into a car accident that claims their life and they recover all of her belongings because all of that got to go on a police report. So they're going to put down there was naloxone in her purse. So now do they not pay out to her family because this nurse had Narcan on her? Wouldn't that be a problem for anybody walking around with Narcan to have a life insurance policy? I'm just saying, you know, in my opinion, don't pay to carry it if it's going to impact your life insurance. He says he's written a half a dozen letters for other BMC employees denied life or disability insurance because of naloxone. Disability insurance too. And that troubles him. So you're going to have a problem with life and disability insurance if you're walking around with Narcan, y'all. The biggest concern is that people will be discouraged by this from getting to a naloxone rescue kit at a pharmacy, Wally says. So this has been frustrating. Wow. The life insurance hassle and the threat of being turned down has discouraged Isela and some of her fellow nurses. She is not carrying a naloxone kit outside the hospital right now because she doesn't want it to show up on her active medication list until the life insurance problem is sorted out. I don't blame her. So if something were to happen on the streets, I don't have one just because I didn't want another conflict, Isela said. BMC has alerted the state's Division of Insurance, which said in a written response that it is reviewing the cases and drafting guidelines for the reasonable use of drug history information in determining whether to issue a life insurance policy. But Isela isn't a drug dealer, and yet she is being penalized as if she were. But see, in her case, it's different. She is a nurse working around addicts. So, yeah, in her case, it's an exception. So I'm saying to all of you, if they do this to a nurse in the medical profession, what are they going to do to these non-medical profession people that are carrying Narcan? Michael Botticelli, who runs the Graken Center for Addiction Medicine at BMC, says friends and family members of patients with an addiction must be able to carry naloxone without fear that doing so will send them to the insurance reject pile. It's incumbent on all of us to make sure that we try to kind of nip this in the bud, he says, before it is any more wide scale. But, you know, I'm just saying in general, carrying it, the insurance companies are going to assume that you have a drug addiction problem. See, that's why a lot of these folks don't want that on the death certificate because some of these insurance companies aren't going to pay out on these life insurance policies with a drug addiction. That's why they try to fight and put other things on there or request that the medical examiner put other things on there and not the drug addiction of what they really died from. Massachusetts is one of the main reasons overdose deaths are down in the state. The most recent state report shows that 20 fewer fatalities this year compared to last year. Okay, so they went down by 20, and in all reality, that's really not a lot. Okay, there is some audio on here that I'm going to play, and I'm sure it's going to go over much of what I said in the article. All right.
Martha Biebinger reports.
All right, let me start this
Be prepared, get naloxone, save a life. That summarizes a campaign launched by U.S. Surgeon General Jerome Adams to tackle the opioid epidemic. But one woman who heeded that call and got the overdose reversal drug found that it was a liability when applying for life insurance. From WBUR in Boston, Martha Biebinger reports.
Blood work was supposed to be the last step in Isela's application for life insurance. But when she arrived at the lab, the receptionist said her appointment had been canceled.
That was my first warning, I guess, and I contacted the agent that made this appointment. And then she came to my home and said, you were denied because it looks like you have something on your med list that you're using drugs.
Isela, who works at Boston Medical Center, scanned her med list. It showed a prescription for naloxone.
I'm a nurse. I use it to help people just in case if there is an overdose, I could save their life.
Primerica is the insurer Isela says turned her down. The company says it can't discuss individual cases. But spokesman Keith Hancock, in a prepared statement, says Primerica, like many life insurers, considers prescription drug use when reviewing applicants.
Now, if a life insurance applicant has a prescription for naloxone, we request more information about its intended use as part of our underwriting process. Primerica is very supportive of efforts to help turn the tide on the national opioid epidemic.
Isela asked that we just use her first name because she's been turned down by 2 separate companies but is still pursuing life insurance. A second insurer said it might reconsider if she got a letter from her doctor. But here's the thing. Isela's doctor didn't prescribe her the drug. She just walked into a pharmacy. When the opioid epidemic hit, Massachusetts and many other states created a standing order for naloxone, one prescription that works for everybody. So Isela had to find the doctor who signed that statewide naloxone prescription. Just by chance, he works in the same hospital. Meet Dr. Alex Wally.
I am the standing order writer, and we want naloxone to be available to a wide group of people.
So Wally is troubled by the handful of denied life and disability insurance applications he's heard about.
My biggest concern is that people would be discouraged by this from going to get a naloxone rescue kit at the pharmacy. So this has been frustrating.
Isela says she and some of her fellow nurses have stopped carrying a naloxone kit outside the hospital. They don't want it to show up on their active medication list until this life insurance problem is sorted out.
So if something were to happen on the street, I don't have one just because I didn't want another conflict.
Boston Medical Center has alerted the Massachusetts Division of Insurance, which is reviewing the cases and drafting guidelines for, quote, the reasonable use of drug history information in determining whether to issue a life insurance policy. But Isela is not a drug user, yet she's still being penalized. Michael Botticelli, who runs the Graken Center at Boston Medical, says many people should be carrying naloxone and not worrying about their life insurance.
It's incumbent on all of us to make sure that we try to kind of nip this in the bud before it is any more wide-scale.
Botticelli wrote to the Surgeon General. Dr. Jerome Adams says he contacted the National Association of Insurance Commissioners. That group says it has not heard of any denials. Adams says it's good to, as Botticelli suggests, nip the problem in the bud.
Naloxone saves lives. And it's important that all Americans understand the vital role bystanders can play in preventing opioid overdose deaths, especially when equipped with this life-saving medication.
More widespread use of naloxone is a key reason, say some public health experts, that Massachusetts and a few other states are seeing fewer overdose deaths this year as compared to last. For NPR News, I'm Martha Biedinger in Boston.
That story was part of a reporting partnership with NPR, WBUR, and Kaiser Health News.
Okay, y'all. You heard it. You know, this is real. You know, I think this is going to turn a lot of people off from even carrying Narcan. But I don't think it's fair to have a medication on a market and the insurance company can penalize you for having the medication. It's not like it's something illegally sold on the streets. This is a legal drug that's sold in the pharmacy. So it's a legitimate drug. So for them to turn this down because you're carrying it is just absolutely ridiculous. You can get a prescription for it. You can walk into a pharmacy and buy it, even if you're not a drug addict, but you're penalized for having it. Makes no sense. I guess the high IQ rules just don't add up. But please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. And I feel sorry for this woman. You know, she really wants to have life insurance, and she can't get it anywhere because of one thing: naloxone, Narcan. Peace, family.